Now we are behind schedule, so I quickly call upon Dr. K.V.N.S. ANIL Kumar, Additional Director, MCH, Government of Andra Pradesh. Sir has served as DMHO of Anantapur and Kadapa for 8 years, and prior he was a DIO and DPO for 3.5 years. He has also served as DMHO Anantapur for more than 5 years and implemented various innovative interventions like Safe Delivery Calendar, Each One, Catch One, etc. He is also served as State Program Manager for NHM for United AP in recognition of effective management of programs at the districts. He is also the Scotch Award winner category Reaching the Unreached for immunization coverage in urban areas in 2017. And he was also awarded as the best DMHO for implementation of NHM interventions successfully in the financial year 2015. Sir, over to you. Sir, you can share your slides.
So, Namaste. I am Dr. Anil Kumar, Additional Director taking care of maternal health in Government of Andra Pradesh. As most of you are aware, Government of Andhra Pradesh is always a pioneer in many of the innovations in public health policies. And as you know, AP is one of the largest states, and we have a huge population, and we have 9 lakh pregnant women registrations and 8 lakh annual deliveries. With this load, with the promotion of JSY and JSSK, and we have been able to increase our institutional deliveries to 99.9%. But however, even though we have made a significant progress, along with that, we had to face the new challenges, like increased C-section rate and overloading of the secondary and tertiary facilities and over-medicalization. And later, with the overcrowding, it is automatically followed by poor quality care and also poor respectable maternity care. To address all these challenges, Government of Andhra Pradesh has started to implement the program after the launch of guidelines for the Government of India in 2018. Once the launch was completed at the national level, we had a meeting with our Principal Secretary, Commissioner and other State Director of Public Health and our team and UNICEF, K.V.N.S. We had a sensitization meeting so that we will be able to do some advocacy with our higher-ups and we will log in them into a system. And once the sensitization meeting with the stakeholders and other superintendents, DCHS, like who take care of our secondary level and tertiary care, heads, DMEs, we had a meeting with them and then we shared our plan of action how to go ahead. For this, we constituted the technical advisory group as well as a supportive system. And the supportive system is from the UNICEF and K.V.N.S. As you all know, implementing an innovation or an intervention in a public health system at the micro level, meso level, and the macro level also. So, for this, we involved our DME and the nursing council of them physically, especially the superintendents of the hospitals and whether the secondary level institutions, and then encourage the midwifery in all the institutions. So we went ahead with the structured group and then systematic manner. We had our meetings. We assessed what is the HR that is required, where we should plan or are required for the future, and what is our stand is, and what are the budgetary requirements, what are the infrastructure gaps that are available. With this team, we have gone ahead and done a gap assessment and a knowledge assessment, and then we went ahead to select first batch of midwifery educators. They have been sent to the K.V.N.S. and then once they are back from K.V.N.S., we have started the trainings in Tirupati and Guntur. The nursing colleges, we have identified 10, but initially we have went ahead with the 2 of them. And now we have our 60 members who have been trained. Okay. Then after having all this structured, are you able to hear me? I hope. After addressing the administrative issues, we have started our batches, and now we have around 12 health midwifery educators, and then 2 batches have completed. Third batch we are going ahead. The milestones are very important for us. We have been the first to introduce a GO in India. We have introduced our GOMS number 205 with the specificity of how to go ahead, who are responsible for what, for the implementation of midwifery. And then we have given a detailed implementation guidelines in consultation by the State Nursing Council, which is headed by our DM. And selection process was also done in a meticulous manner. We have conducted examination and oral examination also. And then we have taken consideration about what is their passion for the midwifery and what is their experience in the clinical base and what are their expectations. And then we went ahead with the examinations and selected a first batch, and they have successfully completed, and they have been positioned in the hospitals. As of now, we are having 1 functional mid-level midwifery unit, which is fully functional, and then they are going ahead. Of course,
sir,
we have some
Anil sir, sorry to interrupt. Can you please share your screen?
It is being shared.
No, sir, it is not. Can we share from our end? Sir, can you please stop it and reshare it, sir? Or else we can share it from our end.
Are you able to see the screen?
No, sir. Yeah.
Is it
Yes, sir. Yes, sir. Now visible.
We had our adequate budget being released to the 2 state midwifery training institutes, and they have successfully come. And with the support of UNICEF and Fernandez, we had a regular monitoring sessions that are being conducted, visits, and then day to day we are taking up the hurdles that are being faced. Next. Okay, now, on the eve of International Midwifery Day, we have inaugurated our GGH MLCU, and then we have conducted a series of sensitization workshops in coordination with the UNICEF and the Fernandez institutions. Next. Next. So we have disseminated these posters to all the institutions where we are promoting mid-level care by the midwifery, and of course they have also been distributed to PSCs and institutions, and with the instructions to display them at the monitoring room or the labor room, and also in the near the OT. Next. So we have launched these guidelines optimal working positions for optimization of state midwifery training institutes. And these are the flip charts that have been distributed, and some of the videos that have been prepared by UNICEF have been shared with all of our P-level workers. And then the problem is always there existing. We have to mobilize the community. We have to sensitize the community. So we have tied up with our CCP, Care Companion Program by Noda Health, who are taking up the sessions at the hospitals as well as the community level, addressing these gaps. and then sensitizing the public as well as those mothers who are coming to the hospitals for ANC visits. Next. So after this, we had done a mid-level assessment. So as of now, we had 6,786 mothers have been taken care of by the midwives, and the risk categories were around 888, and childbirth classes sessions that have been conducted are 5,783. So alternate birthing positions was 1218, and perineal suturing was done in 414, and the number of postnatal mothers who have been accessing the services are 2,511, and newborns assist was 1,271, and resuscitation was 61. OP has considerably been increased, and the services are being successfully accessed by the community, and OP is substantially increasing compared to the last two initial launching of it in the month of October. So these are our clinical outcomes. We have been able to increase the normal births and by 4%, and reduce the episiotomy rate by 3%. So these are the data that is being given. 29% of births that are being conducted without episiotomy, and births without episiotomy by nursing staff. So with the alternate birthing position, upright position was 82%, all fours was 1%, and left lateral we have been doing 18%, squatting was 0.9%. About challenges always exist. The budgetary position and acceptance by the postgraduate students, and allocation of separate beds, and support by the K.V.N.S specialists, and of course from the higher-ups, and acceptance by the community. All this we are planning to go ahead. And then of course there are so many administrative issues, like persons who are being trained will be promoted and they leave the post, and then there is opposition from some of the staff members that they should not be exclusively used in the labor room. We are trying to address all these issues, and to motivate further members and see that they will join in our course. We have to take up large sensitization workshops. We are planning the regular periodical sensitization workshop with the staff nurses who are working in various categories. And then we are planning to go for the career progression, which is already been in an ANIL, and a draft copy is being under consideration by government to give a chip. And we plan to go ahead by opening the 10 nursing colleges. Will be in a phased manner, we will be implementing them. And then UNICEF is providing all the mannequins and the supportive material. And the technical support is given by the K.V.N.S. And then IEC and awareness activities are being done by the CC Care Companion Program by Noora Health. And we hope to see that this will be implemented in near future, so that we will be able to promote normal deliveries, reduce our C-section rate, and then also reduce the maternal morbidity, and of course for the quality of care and the respectable maternity care. We hope to look forward, and I thank all the members, especially the UNICEF and K.V.N.S members who have supported us in this creation, and then our commissioners who have been giving us a continuous support. Thank you.